Thank you everyone for joining us. Those that don't know me, I'm Alex Jevons. I'm Deputy Director of Operations for the Mental Health Care Group at Bradford District Care Trust. This is our first Stay in the Know session, and the purpose of scheduling these and running these is to make sure that we have an opportunity to share our community mental health service transformation journey with partners and with colleagues, and give people an opportunity to ask us those burning questions that you don't always get the opportunity to ask. The Stay in the Know sessions have been planned for the rest of the year, and my very able colleague from our comms team, Natasha, will bob those into the chat so that people can make sure that they've got them in their diaries for going forward. As a little reminder, we are going to be recording these sessions, so can I ask colleagues, if you haven't done already, to please put your microphones on mute so that we don't distract from the main presentations. If you've got any questions throughout the session, if you can bob them into the chat, we'll try and answer them towards the end, where we've got some dedicated time for Q&A. So without further ado, I'm going to hand over to Sasha, who's going to take us through the first part of the agenda. Over to you, Sasha.
Thank you, Alex, and hello and welcome everyone. If I can just remind people to mute and yes, just mute. And it's nice to see people's faces on camera, so
Sasha, somebody's muted you.
Yes, I just realised somebody muted me. I think it might have been the mute all. So I'm not sure what people heard. So welcome and hello everyone. My name is Sasha Batt. I'm the Deputy Director of Integration for the Care Trust, but also the Priority Director for Healthy Minds, which is our programme for mental health, learning disabilities and autism across Bradford District and Craven Health and Care Partnership. So it's great to be here today, and I think we want to use these sessions to share the journey of our community mental health transformation, how that's evolving, how it's taking on the learning from yourselves, but also hear and have speakers to talk about some key topics which you have identified through some of the organisational development days we've had. So just a bit about the transformation programme. So the community mental health transformation is not specific to Bradford District and Craven, it's happening across the country. You will have seen the national framework that's come out for community mental health and how that's guiding some of the views of and some of the approaches that are being taken. However, what we are doing in Bradford District and Craven is absolutely taking the listening from you as our staff, our workforce, and our service members and their carers as to how they're experiencing our services and how they would like to experience our services. And that's right from our community provision, universal provision, primary care, secondary care, through to our specialist services, and how they interact, not just in terms of mental health services, but how do they interact with our learning disabilities, neurodiverse ambitions that we've got for our district, and how we are making our services better and really understanding the gaps in provision that we have. So we've been working on this for 2 years now, really getting to grips with how our services are designed, where we've got some excellent practice, where we've got areas that we need to improve, and how we are faring against that national framework roadmap, as it's called, and how much we've got to do. So ultimately, as I said, what we want is people to receive a seamless support when they need it. And it's the right type of support that's based on a strengths-based outcome. So really building on their strengths, their aspirations, their ambitions that they've got for their own life, and how we provide the support that enables that and brings that together. So this is a partnership between our local authority, social care teams, the voluntary and community sector, NHS health and allied health professionals, all coming together to think about how do we deliver safe services to keep people happy, healthy at home, which is our health and care partnership strapline. So there's loads of work going on, as I said, and if you want to have a look at this, there is a website that is documenting all of this. Quite a few of you have done videos in terms of what the transformation is looking like, what that means for the different types of new roles that we've introduced into our system. So we have used the additional roles reimbursement scheme to create roles in primary care and in universal services. We've developed services with the voluntary and community sector, which include health engagement officers, which include support staff who have real understanding of ethnic and cultural diverse experiences, peer support elements. So a real range of new skills and workforce that is really enriching how people access our services. So as I said, Natasha will put the link in the chat for you to go and have a look at our website where we're documenting this journey. We're nowhere near the end of it. There's still a lot to do. We're still learning a lot from the data and from the information that people are sharing us, but also from the stories of people and what we need to do more of. The framework that we use, and I'm not sharing any slide at the moment, but again, if you look on the website, you will see a framework that we've developed, very much rooted in people being able to access universal services in their communities that help them lead that better life well and respect their rights, but then providing that community support or specialist support when people need more help and access to support. So that's how we're building that model. As I said, there's some short videos there, and every quarter we come together as a whole team where we invite some of the team managers, team staff members to dive into how we are developing volunteering, how we're developing that shared training across our system, how we are really building aspirations for people who access our services and thinking about that lived experience, how we are thinking about the different topics that affect people's lives, which will bring me on to the focus of today. But I'm just going to stop there and see if Alex wants to share anything from the last organisational development day that we've had with staff.
Thanks, Sasha. So we did a district-wide OD session, I think probably beginning of December. My memory fails me on the timescales. And in that session, we heard very strongly from colleagues that they wanted us to start engaging in each of the locality teams, so we could have direct conversations with frontline staff around the transformation programme. What we've already delivered to date, what is still outstanding, and some of the rationale behind the reason for transformation. So we have scheduled those. They started a couple of weeks ago. We had our first session in Craven. We ran another session last week with Air Wharf, and we have 3 sessions with City, South and West and North CMHTs planned over the next 2 to 3 weeks. I think the last one will be taking place by mid-February. And as part of those sessions, we're sharing some of the original NHS England background and rationale for why community mental health services are being transformed. We're sharing some of the findings from the review of a very serious incident in Nottingham following the death of a number of members of the public by a gentleman who had been recently discharged from their mental health services, and what that means in terms of our self-assessment that we've undertaken in respect of our performance against the standards NHS England expect. We're sharing information around the implementation of the MAST tool, which is a management and supervision tool around caseloads, and very visual tool for people to use in respect of their caseloads. We're sharing the developments around the treatment team, the core VCS offer within each of our places, the COMHAD offer, which is the co-occurring mental health, alcohol and drugs team, as well as sharing information about our ARS worker offer and our core psychological therapy offer. So a lot of information giving, but a real opportunity to share and for people to ask questions. Again, those tricky questions that people often don't have the time or the space to put towards the leadership team. We've then been meeting with our leadership teams in each of the 5 localities to share the outcomes of a really important piece of work that a lot of you will have contributed to in the summer last year, and that was around reviewing current caseloads that are sat within community mental health services. So understanding what level of risk individuals might pose to themselves or to others, understanding and doing a reclustering exercise to understand how we might segment the current caseloads, and we're playing some of that information back so that the team managers can then share that onwards with their teams. So far we've had some really good feedback, lots of engagement, lots of interested conversations, and with people going away feeling really quite excited by and optimistic around the transformation journey. So we will be coming to a place near you shortly if we haven't been already, and hopefully colleagues that have been to those sessions will be happy to share their reflections if they're on this call today, and give us that live feedback, as we've said in each of the sessions, the good, the bad and the ugly. Happy to hear it so that we can shape future engagement events. Thanks, Sasha.
Brilliant. Thank you, Alex. We've got about 5 minutes maybe if people have got any questions specifically on the transformation. What we're hoping to do with these sessions is have a conversation about where we are with transformation, but also then discuss a hot topic that has been chosen by yourselves. And today we are talking about Ramadan and the impact on mental health. But any quick questions while we've got probably about 5 minutes before we were scheduled to start that conversation? No, if not, then as we've said, there's information on the website. Natasha's put the link in the chat. You can have a look on there. There's, as I said, a whole host of information there about the transformation journey, some videos by staff members and by service members and carers talking about the changes that they want to see and that they are seeing. There's some reviews by other members of our partnership, but also there's some information about other pieces of work that we're doing, particularly around ethnic and culturally diverse communities, around severe mental illness and the interaction between physical health and how we are really learning from the learning disabilities world of how they are improving the health of people, and really making sure that those physical health checks and that learning of including and encouraging people to volunteer, to be active, be citizens in our district, how that really impacts on their well-being overall. So some really good things for you to look at and explore throughout that website, not just around Healthy Minds, but around what's happening in other work areas as well. Okay, so I'm going to move us on to the hot topic for today, which is about Ramadan and severe mental illness. So we often talk about everyone has mental health. We all have mental health, but not everyone has mental illness. And rightly or wrongly, with the whole emphasis on mental health, I think sometimes we have forgotten about the stigma that still is attached to mental illness and the experiences of people around their mental well-being. So what we wanted to talk about today was Ramadan. How that what it is, and I will share that, but then really talk about some of the things that you might see in your practice in terms of supporting people, and some of the challenges, but also some of the strengths and opportunities we can tap into to support people. So what is Ramadan? I'll start with, it's one of it's one of the 5 pillars of Islam. So when somebody says that they're of the Islamic faith, there are 5 pillars that come to make that up. And so the first pillar is absolutely that belief in one God. So it's belief in one God, and that the messenger of that message of one God, of one religion, is by the Prophet Muhammad. So that's the first pillar. The second pillar is that people will pray 5 times a day. So Muslims will pray 5 times a day, spread out throughout the day. And the third is that they will give charity. So they will give, and that's a very core part of belief, that you will give charity and think about people who have less than yourself, and have that as a something that you're very aware of. And then the fourth and the fifth pillars are around actions that people will carry out, which is to fast during the month of Ramadan, and to, once in their lifetime at least, try and perform the pilgrimage to Mecca, which is called Hajj. So talking about Ramadan then, Ramadan, that month of fasting happens in the 9th month of the year of the Islamic calendar. So the Islamic calendar works on the lunar calendar rather than the Gregorian calendar, which is why people often ask why it moves throughout the year, because the lunar calendar is about 10 days shorter, 3 or 4 days shorter than the Gregorian calendar. So every year it moves. But I think every 33 years it kind of comes on par with the Gregorian calendar. So it's the 9th month of the year, and it's a month when people will fast, and that fasting includes withholding from food and drink between dawn to dusk. So it's just before the sun rises and as the sun starts to set. That's the time period of that fasting. And what this is, what that means, it's, yes, refraining from food, but it's also refraining from certain habits like smoking or alcohol, and people won't drink alcohol, but if and you know, no judgment, that there are people who will have habits that maybe are un-Islamic, but during the month of Ramadan they will absolutely keep to the tenets of Islam and not do those things. It's also a month where people will increase their volunteering into their communities, into services and charities that they work with, and increase how they are carrying out one of the other pillars of Islam, which is around that zakat, that charity, and increasing the charity that they give to communities and to people, and making sure that you are feeding the poor and sustaining the communities around you. So those are the key things that people will do during Ramadan. It's a key time that people reflect, and they will connect to their faith. And during that month, people will aim to try and read the full Quran, the holy book. And so you will see people, as well as performing their 5 prayers fasting, they will in the evening go to congregational prayers, where they will complete and aim to complete the Quran throughout the month. So there are exclusions to fasting, so not everyone has to fast. If you're a child, or if you have recently given birth, or are pregnant, or on your period, and have a health condition, those are some of the exclusions to fasting. And the reason for that is preservation of life is one of the key things around Islam, is that we should make sure that you preserve life and you sustain life. So that's the reason why there are those exclusions there, because first and foremost you should be thinking about that preservation and looking after yourself. So that those exclusions then include some of those medical exclusions. But because fasting is such a fundamental pillar of Islam, a lot of people will want to continue to fast, and that's part of the conversation we'll have with Salman in the next moment. And so, as I said earlier, sometimes you will find people fall ill because they fasted, and maybe it wasn't the best course of action, or that they have, that there are other things that they increase and want to do. So if you are supporting your team or a team member in your team who is fasting, what are the things that you need to be aware of to support that? So at the back end of 2023 and last year 2024, we held a series of webinars for professionals and people, and that was in partnership with the British Islamic Medical Association. And these webinars were aimed at starting to prepare for people who have severe mental illness for Ramadan. And there were 4 webinars that took place. One which was on understanding and the awareness of Ramadan, the clinical management of people with severe mental illness during this month, the psychological impact and psychological support for people. And then the 4th one was around the role of carers and the community. In addition to this, we also had some sessions that were led by our social care team, which was about again, raising awareness and also looking at practice and good practice that they shared. And Rob Mitchell and a few members led those pieces of work. And so we are hoping to repeat those. Again, the webinars that were held were all recorded. So Natasha's put the link in the chat. You can go and have a look at those webinars, see the questions, see the conversations and discussions and the presentations by a whole range of speakers that took place. So really encourage colleagues to have a look at that. But coming on to today, our guest speaker for today is Salman Waqar, who is an academic GP, former president of the British Islamic Medical Association, although at the time of being part of this last year, he was the president of British Islamic Medical Association. Really want to take this opportunity to thank Salman for his partnership, his spurring us on in terms of how we're thinking about our system and what we're doing and how we're supporting people in a range of things, not just during Ramadan, but generally around the support that we're providing for our population and our communities, and really thinking about how we deliver a much more holistic and wider partnership approach to supporting people. So I'm going to ask Salman to introduce himself, and I think he's going to talk to us about how staff can support people with either their care needs or their medication prior to Ramadan, what happens during Ramadan, and managing and supporting people who have a chronic condition. And then talk about what it means to have a healthy Ramadan for people. So over to you, Salman, and if you'd like to introduce yourself.
Yeah, and of course, thank you, Sasha. Good afternoon, everyone. Hope you're all well and warm and away from the wind. I'm not up north, I'm down south where we were mercifully spared from the wind, but I know things were quite difficult up there. So I hope you're all well, and thank you for the invite and for the continuing partnership. It's really great to be here again. As Sasha kindly introduced me, I am a GP. I am clinically active, and I'm also an academic. I say with a small a, dare not say I haven't got any elbow patches, but I do do a bit of research, and my research interests have mainly been around that interface between faith and public health, and in particular around Muslims and Muslim communities and how they bring their full self into the consultation room. And a lot of that has been formed by my experience as a clinician, but also as someone who has been involved in coordinating the British Islamic Medical Association, which is a group of Muslim clinicians across the UK. And we all have had that sort of shared experience of, well, having that lived experience, really, of being professionals when we go home and when we do things ourselves, when we have our own health conditions or when we try and get about our day. We don't necessarily find we're able to bring our full selves into the table in the context of health inequalities and inequities, both in outcomes, but also in experiences. How can we look to address that differently? So that's what spurred on my, in particular around Ramadan. This came about after the pandemic, where there was a lot of uncertainty around safety and fasting in the context of the virus. And so we did a rapid evidence review, which looked at all different conditions, including mental health, as to what the safety is of fasting in those conditions, and how we presented that to the public. And that's been quite a productive piece of work that we've got about 15 or 16 papers out of that, all in the high quality peer-reviewed journals. And that led me to think about, actually, this can't just be sitting on a shelf in an ivory tower somewhere. This has to be a live thing. Because actually, how do we encourage and empower clinicians and systems and policymakers to think differently around this? So just to give you a context, which this hopefully wouldn't be news to any of you who are working in the area that you are. Well, Muslims are an incredibly diverse group. We are, as a majority of individuals, we are hailing from ethnic minorities. And so if you look at the census data, about 2/3 of people who are who tick the Muslim box also tick the South Asian box. So the majority of Muslims are South Asians. Of course, you will know that not all South Asians are Muslim, but it's important to recognize that 1 in 3 Muslims are other, and that includes about 20% of Muslims who are actually white British or white other. So there's a significant ethnic diversity there. So it's important to not have those assumptions when you're thinking about the Muslim community. Again, in the context of the world that we live in right now and how we get our news media, Muslims are unfortunately othered and problematized quite a bit. Um, and there's also this element of racialization of Muslims as well. So you think of Muslims as a people. It's a faith, it's a belief. You don't think of Christians as a people. You don't think of other faith traditions as a people necessarily, although I appreciate there are some exceptions to that. But certainly Muslims are incredibly ethnically diverse. There's more Muslims in China than there are in some parts where people think are majority in Turkey, for example. People don't necessarily appreciate the vast diversity of the faith belief. And the reason I mention that is because it is that element that we're trying to speak to here when I'm talking about Ramadan. It's a faith tradition that is observed by people across different beliefs and different value systems who share that commonality. And as Sasha said, there will be people who have different practices. They may drink alcohol, they may not pray, and so on. But the religious observance of Ramadan is actually something that survey data consistently in both the East and the West shows that communities are observing. So 93% of Muslims across the world will be observing the fast of Ramadan, even if they may be drinking or having extramarital relations or doing all the things that aren't classically part of Orthodox Islam. They will be observing the fast of Ramadan. And the key element there is because of that social element. It binds people together, it brings them together. And so if we don't talk about that in our consultations, we don't talk about that in our communications, we don't talk about that in our settings here, it's not going to be something that people can feel that they can bring their whole self to. And the key thing about Ramadan is that it is actually you are having to prepare yourself for quite a substantial change to your routine. If any of you have worked or lived or traveled through Muslim majority areas or even areas where there are Muslim minorities, you will know that, as we all feel that sort of that excitement that comes about when it's almost Christmas time, the radios, the songs change, the wards or the office, they kind of, the tinsel comes out, the Christmas trees come out and everything. It's the same thing for Muslim societies as well. But more than that, it's actually a month of individual exertion. So imagine Christmas Day, but multiply that by every day over Christmas in terms of what's happening. So imagine having a Christmas meal every day for 30 days. That's kind of like what Ramadan is like. And so you're having to prepare yourself for all of that. So whether it's the socialization element or whether you do a Christmas mass, for example, the religious and the worship element there, or whether you're thinking about what food you're going to prepare and cook and eat to get you through the day, all of those things are put in on top of having to find the time to work, to study, to do all the things that you need to do. And again, in the context of you being a minority population where most people don't have a clue about what you're doing. And so if you have got a health condition, and particularly if you have a mental health condition, you can see how straight away the cards are pretty much stacked against you in terms of your ability to engage with all that. So if you aren't being asked about Ramadan when you're speaking to a clinician, whether that's about the medicines you're prescribed, whether that's about the therapy you're going to receive, or whether that's about anything to do with that, you can see how you might find it difficult to actually say, well, this is an important part of who I am. And when it comes to things around guidance around what to do with people who are in your situation, what is safe and what is unsafe, you can see how that also creates a problem where we are very much protocolized and driven by what evidence and research says. And so that's why I'm really grateful and really excited about the conversations that we're having in Bradford, where we are able to bring in this new approach to dealing with health inequalities. Einstein said the definition of insanity is doing the same thing and expecting different results. Well, I hope this is something different. It's a novel approach to addressing long-standing inequalities in ethnic minority populations. And I stress they're not all the same ethnicity. And neither is it all because of poverty and deprivation. Interesting fact I learned last week, if you are the most affluent Asian, Bengali man, I should say, your risk of dying from a heart attack is as much as if you are a poorest white man. So there are some issues there around, deprivation certainly has an element to play, but there are also other factors. They could be genetic, they could be social, they could be systemic, there could be many of these things. But there are issues out there that are affecting certain populations, and we have to know them, we have to own them, and we have to be open with them. So that's where I hope this conversation can lead us to. And Sasha just asked me to briefly explain, what that looks like, and I sort of listed some of those things there. But I think in practice, it is genuinely about owning the fact that this is happening. So in conversation and communication with these communities and societies and internally, just thinking about how can we engage them in the same way that we might engage our community when it comes to Christmas. So you all may have been to Asda, Tesco, pick your supermarket. You probably would have seen by now a Ramadan aisle, right? And so if the supermarkets, if the capitalist, consumerist people are looking to engage with that population this way, we too should be looking to think about how do we engage with them. And that's just as much about the optics of it, but also about the substance of it as well. We need to make sure that the products that we're putting to our customers, to our clients, to our patients are also fit for purpose. So that's why it's really great to hear that in Bradford there are culturally tailored psychotherapy options available for patients, but it's also perhaps thinking about how are we demonstrating that this is giving us access to areas and to populations and to outcomes that we hadn't seen before. So making sure that we are still keeping our finger on the pulse and a foot on the gas, I should say, to make sure that we're seeing how we can ease out and eke out further gains. So another thing that I again mentioned to Sasha was that things around, and I know that may not be the gift necessarily of the team here, but thinking more holistically in terms of smoking cessation and weight loss and physical activity and all these things, I think is a very important way to make communities feel like you're genuinely caring about them and concerned about their well-being. And I'll end with this by saying that if any of you haven't come across Muslim families or Muslims preparing for Ramadan, there is an awful lot that's going on in their heads right now. Everyone's thinking it's a month to go, and have I done my shopping? Have I got my meals plan sorted out? How am I going to do this? If I'm working shifts, when am I going to take my leave? All that sort of stuff. People are thinking about it right now. And if we can just drip feed into that things about your health, how am I going to be healthier? How am I going to stay physically active? How am I going to have, think about being, trying to reduce my blood pressure? How am I going to make sure that I'm staying more mindful and so on? This is 30 days of people making a literal day and night difference. Instead of waking up at sort of 8 o'clock, they're going to start waking up at 4 o'clock. Instead of, going to sleep at 10 p.m., they're going to go to sleep at 1 a.m. Instead of, shopping once a week, they're going to be shopping every day of the week. So there's a significant fundamental change that is happening I think in Bradford, 30% of your population, if I'm not mistaken, Sasha, 30% of your population is going to be doing this. Are we ready? Do we know, and have we adequately prepared our services? I hope that small thing there was just a helpful framing of the issues, and happy to take any questions, Sasha, or to answer anything that I didn't address in your remarks.
No, thank you, Salman, and thank you. It was just it's just refreshing to hear from somebody who's not entrenched in our own services and systems about what we can be doing, what's happening, and why this is so important for us to focus on. And I think the point you made about any type of support we're providing, if it's not in the framework of the life that person leads, it's going to be absolutely meaningless. And if this is such a fundamental part of someone's life, we've got to think about how is that informing the way you set up your appointment, the way that you frame your conversation, the way that you offer the support and the opportunities that you're offering through the work that you're doing. It has to be something that's first and foremost in that thought. So we're 33 days away from Ramadan, so there's a month or so left for people to prepare and to think about the support that they're offering to service members and carers, and to people, but also about the staff teams and your colleagues and what that looks like. So lots of things for people to think about. Are there any questions that people want to share? And I don't know if anybody's here from social. I think probably think I can see Wahid, but I don't know if anybody else is here from the social care team who might want to share some of the things that you've been doing as well, because that would be great. But it'd be good to hear some questions and good practice. If people either just want to put their hand up. Rebecca, you've got your hand up.
Oh yeah, thanks Sasha, and thanks Salman for your presentation. It isn't really a question, it is just a comment of support for colleagues. So and to recognise that the as you've just mentioned, Sasha, it's not only people out there in receipt of support from services, but it's the people delivering the services too that will be also celebrating or experiencing Ramadan. So it was just to make that point, but also to make the point that there is an impact, therefore, by definition, on the ability of some teams to deliver services because of because staff are experiencing Ramadan. So I don't really know if it's a question, but it's a thing. And what just to focus on that and ask what might be the best ways for those of us who aren't Muslim and going through Ramadan to support those colleagues as well.
Rather than me answering, I'm wondering if there's a team leader or team manager or service manager who wants to kind of share what they've been doing to support their colleagues. That would be great if somebody wants to share how they've been doing that. I'll start picking on team managers or service leads if nobody wants to speak up.
I think Elaine's got a hand up.
I have, but mine was a different point.
Oh, brilliant. All right. Yeah. Oh, sorry, it wasn't showing up on mine. Elaine,
you've got somebody else's hands that might be a reply to your question first.
Well, I've got your hand up first, so then we'll go over to Hisham. Sorry, it wasn't showing up for some reason. It is now.
It's okay.
But
yeah, just so first of all, Salman, thank you, and thank you for your wisdom and your time this afternoon. And yes, there are a large number of colleagues from social care across mental health and learning disability services who've joined us this afternoon. So thank you to all colleagues who've joined us from the social work teams. We during the build up to Eid and during Ramadan, we try to plan a little bit differently about how we manage our work day, and particularly when it's some of the longer periods of time, just to be a little bit more sensitive about how people might be experiencing it without wanting to take away that actually part of the fastest part of the experience. But there is something about kind of sensitivity on my part and on colleagues' parts that tends to come in, thinking about scheduling of meetings, recognising that you want people to be at their best, and as the day goes on, that might be a little bit harder for them. In terms of what we do during Ramadan, Sasha, which we might be able and willing to share, since 2020, and we started this during the pandemic, we have taken the opportunity to make this a journey of collective giving, and we work together to do that. So we work with local out of school clubs who have the after school clubs make cards, which we make sure that we have checked everybody who's known and open to our services in long-term support, and reach out to provide them with a card if we think that they're unlikely to get that social support through other networks. Try to make sure that that people who might be quite isolated are connected into some of the collective opportunities to break fast. Thinking through about some of the issues around health and diabetes management and how that might affect behaviour change. Salman, I think colleagues on the call would be particularly interested in any advice that from a health perspective you might be able to give about the impact or anything we might want to watch, because we wouldn't want to disproportionately respond to people's behaviours that might be triggered as a result of changes in blood sugar levels or anything else that we wouldn't clinically be looking at as social care, but perhaps where we might be signposted towards, to just make sure we've considered that and ruled it out. And then going forward, Sasha, one of the things that we've been doing in the last 18 months to 2 years, and we have some really strong stories now, is supporting people with Hajj and recognising that Hajj is a really important part of somebody's social assessment. And we've got some good, strong examples now of where we've been able to support people through the use of direct payments, joint funding arrangements for personal health budgets, to experience the Hajj just like anybody else, and how we've managed the concerns around risk assessment, including some very high-end concerns about what might happen to people whilst they're outside the country. So we have a lot of expertise and experience around that, that we'd be really keen to explore whether that's another aspect of this we could share, and maybe get some consent to share some of those stories as well, because stories touch hearts and minds, don't they?
Absolutely, that would be great. Brilliant, thank you. I'll come back to some of Rebecca's questions in a minute, but we'll hear from Hisham and Wahid first. Hisham.
Hi, Sasha. I'd just like to touch base on what Rebecca said about how we as a service manager or senior service manager could support our staff. So I think first thing is about making sure that other colleagues understand Ramadan like we're doing now, the effects, what's going to happen, how people will be functioning, also taking people personal life into consideration, so maybe shorter breaks if people want more breaks, or maybe if you want to have at the end of the day so they can go and rest since they want, if there are shifts, how their shifts looks like. So for example, one of my services, it's around 6:30 to 9:30 in the evening. So speaking with people who's fasting and see if this is something suitable for them, or they need to swap with other staff, or maybe taking some annual leave. So about considering their circumstances and how the best way of us supporting them, and look at not only on team level, also as organization level.
Yeah, thank you, Hisham. Wahid.
Thank you. I just want to firstly thank Dr. Salman for the insight, and particularly how Ramadan relates to things like public health. That was really good insight. So thank you for that. I think from firstly, someone asked about kind of the impact in terms of staffing and service delivery. I think first things first, I think now might be the time for us, particularly those of us in management, maybe just to sort of explore how this is likely to impact our staff, who's likely to need time off, and how it's likely to sort of obviously impact their well-being at work. So we'll, from a local authority perspective, we'll certainly be looking into that, given the diversity within our staff teams. And then secondly, obviously, it's the impact that this is likely to have on service users. So these are quite important conversations to quite a lot of service users who are likely to be observing the fast, and their families and carers, kind of exploring questions around how they, whether we need to make any adjustments to people's support plans during Ramadan, whether, they could perhaps look at taking some of their medication a little bit earlier or a little bit later once the fast breaks, and I guess exploring any impact that the fast is likely to have in the health, and maybe for our staff to record that in support plans and assessments. Certainly from a local authority stroke care act perspective, it is quite a vital conversation around people's well-being. So I think once we've, I would like to see a bit more direction for staff around that. So I'll be looking into it a bit more.
Thank you, Wahid. Salman, do you want to come back in on that?
Yeah, no, I was just wanting to say in the chat, if people hadn't seen, I've popped a paper that we published around Ramadan and occupational health considerations. So I think that's an important thing to bring into account here around that individualized conversation with a colleague and management and occupational health, especially if they have got chronic health conditions. That need consideration, or at least occupational health colleagues to advise in the context of the work that individuals are doing, if there was any particular consideration to take. But generally speaking, I should stress that we're looking for fairness and not favors. People are still working during Ramadan, people are still doing what everyone else is doing. And certainly service pressures and business continuity has to be part of the conversation. And indeed, there's, speaking as a medic, there are A&E departments and many other places which are predominantly staffed by Muslim colleagues, and they make it work. I think the key thing here is around communication and making sure that those conversations are happening, and it's happening in a healthy and a wholesome way, and not in a sort of punitive way that sometimes can happen. And I think that's really the main takeaway. And I just also want to say, Elaine, what you mentioned there about Hajj and personal budgets was real music to my ears, because I think that's the type of innovation that I'd really encourage us to champion and to try and move us away from. I know colleagues aren't doing this are meaning this, but we can sometimes entrench ourselves in inequalities and problems and not think about opportunities and solutions. And how can we look at things slightly differently? And I think that would, for me, would be the types of real innovative pieces that I think communities will also be very enthusiastic about, because they then see the sense of self presented in a more dignified way, I guess, and there's more parity of esteem there. So it's not like, oh, there's a risk of fasting, so we have to be careful. There's a safeguarding concern, yes, we have to be careful. It's actually, this is something that you want to do. Let's try and make it happen. And again, just going back to I know the smoking thing is a negative thing, but let's look at it another way in terms of weight management and weight optimization. Let's look at it in terms of physical activity. Let's get to a level that we want to be working with your understanding and your communities and the way you see the world. But I just reiterate, absolutely, we want people need to be working in Ramadan. There isn't anyone trying to sort of wiggle their way out of it. I know that's not what was the point that was being made. It is mainly about fairness, and it's about really making sure those conversations are happening, and they're happening in earnest, because it takes a while to get the voters ready. It takes a while to get all those things sorted out, and if there are gaps, they need to be accounted for.
Thank you, Salman. I'm aware of time. I think we have got about 5 minutes, but I think I just wanted to emphasize that point about the opportunities and the positivity. So while sometimes you might come to some of these sessions because it almost feels like we're framing, Ramadan and mental illness, is there an issue, etc., but there's absolute opportunity here. Elaine shared some good opportunities. I think the opportunities around our volunteering and really tying that into the opportunities for people with lived experience and how they can do that, and all the alternative things that people can do if they're not able to fast. What are the things that they can get involved in terms of charity giving, in terms of that volunteering, in terms of understanding more about their faith and learning more about that. So how can we support that, both in terms of people we support and our staff members as well. So, and I think that the whole aspect of having these conversations openly means we can acknowledge that and understand what that looks like. And you might see some of the teams. I know there's some tinsel competitions leading up to December. There might be some similar competitions coming up that you'll see in the next couple of months on desks and etc. So that is just great to see that being celebrated. There's a couple of things that are happening across the system in terms of people. So there's a Fasters one, which is where we're inviting all staff members and colleagues across our health and care partnership to experience and share that one day of fasting. I think Natasha will put that into the chat, but also again, from your locality teams, your neighbourhood teams, understand and find out what's happening in local areas, because you'll have the voluntary community sector, some of the faith sector organisations putting on really open events which invite people into the mosque spaces, but also to share their learning and share things that are happening in each of their communities. So do find those out, so that they are happening across the district this month. In Ramadan. And the Bradford, I think it's called the Ramadan Tent project. That's a national project. They are hosting events in Bradford as well as part of the City of Culture activities. So again, we'll share some details on that if people want to attend with their staff teams to one of those events. So that those, I think tickets for those will go on sale from this Friday. So yes, so lots happening that you can get involved if you want to learn more and find out more. And Natasha and Salman have put some links in our chat for us to have a look at. This session itself has been recorded, so if you did want your colleagues and other members to have a look at it, they will be up on that partnership website. So do go ahead and have a look at that and share with colleagues who maybe have not been able to attend today. Before I close, are there any other questions or comments, Salman, Alex, anything that you want to share before we finish?
Not today, Sasha, thank you.
Okay, brilliant. Well, thank you everyone for joining, and have a good rest of the week, and hope to see you at the next one.